The recent NCCN guidelines take into account the new approved drugs for pancreatic cancer. Remember, historically, we were limited to one drug, that being gemcitabine. Now we have two drugs that have been approved over the last 5 years, that being nab-paclitaxel, Abraxane, and also, more recently, Onivyde, or nanoparticle liposomal irinotecan. And so this patient was treated with Abraxane gemcitabine, then went on to Onivyde, MM398, the liposomal irinotecan, and then went on to FOLFOX chemotherapy. The NCCN guidelines suggest that if you're given, or recommend, if you're given gemcitabine-based treatment in the front line, that second line, you go on to a clinical trial, or you go on to Onivyde, MM398. That's a Category 1 recommendation. So this patient was treated very strictly along those guidelines. Now, alternatively, the NCCN guidelines also recommend that if you're treated with a 5-FU-based chemotherapy, for example, FOLFIRINOX, if you're given that regimen up front, then you go on to a gemcitabine-based treatment in the second line, or again, an experimental trial. But that approach can be more challenging due to toxicities that are encountered in the front line that affect your ability to treat in the second line, meaning giving oxaliplatin in the front line with your 5-FU-based treatment, and then giving Abraxane with gemcitabine-based treatment in the second line can be very challenging for many patients.